The NHS is the world's fifth biggest employer, with around 1.5 million staff, offering more than 2,300 different surgical procedures and treating 1 million patients every 36 hours.
Healthcare should be like this. It should be free at the point of access. I don't think patients should have to worry about when they're poorly, how they're going to fund things.
In the scope and complexity of the treatment that it now offers, the NHS is almost unrecognisable from the service first founded 70 years ago. But one thing remains the same: the driving principle behind it all. In the words of Nye Bevan, the then Health Minister in 1948, no society can legitimately call itself civilised if a sick person is denied medical aid because of lack of means. The NHS has helped UK average life expectancy rise from 68 years in 1948 to 81 years now.
Wonderful new drugs, new technologies. Just look at the huge revolution happening in digital, how we embrace innovation, because with innovation we can improve the quality and safety of care.
But that longevity means today's NHS is facing unforeseen challenges from obesity, dementia, cancer and cardiovascular disease. Earlier this year, a parliamentary committee warned that the NHS finances were in a perilous state. An extra $27 billion was pledged last month, but the government spending watchdog warned that even that was not enough to improve services. Hospital administrators are contemplating difficult choices based on clinical outcomes and affordability.
And if we see procedures, if we see things that we're doing in the NHS that aren't value for money, then let's have that conversation with the public to say, actually, we'd be better off spending the money doing something else and looking after a group of patients in a different way.
The NHS remains free at the point of access, but thereafter there are no guarantees. Social care of the elderly is in crisis.
I think it is a worry, especially for people my age, because the older you get, the more likely you are to have call on them.
We have got people that potentially don't want to go home because they're nervous or they live on their own and they don't know how they're going to cope. So it's finding everything to put in place so that they have that reassurance and they know that they will still be cared for when they go home.
The problems have not gone unnoticed. There are regular demonstrations against hospital closures and cutbacks. This protest last weekend attracted thousands of marchers. The public affection for the NHS remains undimmed, and there is much to celebrate about the past 70 years. But the prognosis for the service remains uncertain. Paul Brennan, Al Jazeera, Milton Keynes.